Welcome to our guide on congestive heart failure, CHF, and heart disease. CHF is a condition where the heart doesn't pump blood as well as it should, leading to symptoms like fatigue and shortness of breath. Heart disease encompasses various conditions that affect the heart's function and structure. Understanding CHF and its treatments, including medications, is crucial for managing this condition. Join us as we explore the basics of CHF, heart disease, and the pharmacological treatments that can help improve quality of life for those affected. Congestive heart failure, also known as heart failure, is a serious condition where the heart doesn't pump blood as well as it should. Despite the name, heart failure doesn't mean the heart has completely stopped working. Instead, it means the heart muscle has weakened over time or has a mechanical issue that limits its ability to fill with blood. Because of this, the heart can't keep up with the body's needs, causing blood to back up or become congested. This results in not enough oxygen-rich blood reaching the body's organs. When the heart can't pump effectively, it leads to various symptoms. People with heart failure may experience shortness of breath, fatigue, and swelling in the legs and ankles. These symptoms can significantly impact daily activities and overall quality of life. Additionally, heart failure can cause fluid buildup in the lungs, leading to persistent coughing or wheezing. Heart failure can be caused by various factors, including coronary artery disease, high blood pressure, diabetes, and previous heart attacks. Managing heart failure often involves lifestyle changes, medications, and sometimes surgical procedures to improve the heart's function and alleviate symptoms. Regular monitoring and follow-up with healthcare providers are crucial to effectively managing the condition and preventing complications. Over 5 million people in the United States have congestive heart failure. It is the most common diagnosis for hospitalized patients over the age of 65. 1 in 9 deaths lists heart failure as a contributing factor. The best way to prevent congestive heart failure is to avoid or carefully manage conditions that contribute to it, according to Jones. Stop smoking. If you smoke, quitting is crucial. Smoking is a major cause of arterial damage that can lead to heart failure. Avoiding exposure to secondhand smoke is also important, as it can have similar harmful effects. Seek support through smoking cessation programs, medications, or counseling to increase your chances of quitting successfully. Eat heart-healthy foods. Choose foods that are low in saturated fat, trans fat, sugar, and sodium. Focus on a diet rich in fruits, vegetables, whole grains, low-fat dairy products, and lean proteins like skinless chicken and fish. Incorporate healthy fats found in olive oil, nuts, seeds, and avocados. For practical tips and recipes, check out resources like Eat Smart, which offers guidance on how to create a heart-healthy eating plan. Maintain a healthy weight. If you're overweight, losing weight is important. Combine a balanced, nutritious diet with regular physical activity to achieve and maintain a healthy weight. Engage in activities like walking, jogging, swimming, or cycling for at least 150 minutes a week. Regular exercise not only helps with weight management, but also strengthens your heart and improves overall cardiovascular health. Manage other heart-related conditions. If you have another type of heart disease or related condition, follow your treatment plan closely. This includes taking prescribed medications like statins for high cholesterol, ACE inhibitors for blood pressure, or beta blockers for heart rhythm issues. Regular checkups with your healthcare provider are essential to monitor your condition and adjust your treatment as needed. Jones emphasizes that recent research shows long-term statin therapy helps prevent heart failure by preventing heart attacks and coronary events that lead to it. In addition to these measures, reducing stress through relaxation techniques, getting adequate sleep, and limiting alcohol intake can further support heart health and help prevent congestive heart failure. Diagnosing heart failure involves multiple steps and tests, as there is no single test to confirm the condition. Your doctor will take into account your medical history, family history, physical examination, and various test results. These tests can include electrocardiogram, EKG. This painless test measures your heart's electrical activity, helping to determine your heart rate and detect any previous heart attacks or abnormalities. Chest X-ray. An X-ray image of your chest that shows the heart, lungs, and other structures. It can reveal if your heart is enlarged or if there is any lung damage. BNP blood test. B-type natriuretic peptide, BNP, is a hormone measured through a blood test. Elevated levels of BNP indicate the severity and prognosis of heart failure. Echocardiogram. This ultrasound test provides detailed images of the heart's structure and function. It differs from a Doppler ultrasound, which specifically assesses blood flow to the heart and lungs. Holter monitor, a portable device you wear for 24 to 48 hours to record your heart's electrical activity over an extended period. This helps identify irregular heartbeats and other abnormalities. Exercise stress test. You will be asked to walk on a treadmill or ride a stationary bike to monitor your heart's performance under physical stress. If you're unable to exercise, a drug may be administered to simulate the effects of exercise on your heart. These tests, along with a thorough examination and assessment of your medical history, help your doctor accurately diagnose heart failure and determine the most appropriate treatment plan for your condition. Heart failure cannot be cured, but treatment can help relieve symptoms and slow down further damage. The treatment plan depends on the stage and type of heart failure, underlying conditions, and individual needs. Key components of a treatment plan include lifestyle changes. Similar to prevention measures, these include a heart-healthy diet, regular exercise, and quitting smoking. You may also need to avoid salt to prevent fluid retention, and caffeine to avoid heartbeat irregularities. Your doctor will advise you on how much fluid to drink and which types, as fluid intake may sometimes need to be limited. Medications. Several types of medications are commonly prescribed to manage heart failure. Vasodilators. These medications help expand blood vessels, making it easier for blood to flow and reducing blood pressure. Diuretics. These drugs help remove excess fluid from the body to reduce fluid retention. Aldosterone inhibitors. These help with fluid retention and can improve survival rates. ACE inhibitors or ARBs. These improve heart function and life expectancy. Digitalis. Glycosides. These strengthen the heart's contractions, helping it pump more effectively. Anticoagulants or antiplatelets. Drugs like aspirin help prevent blood clots. Beta blockers. These improve heart function and can also improve survival rates. Tranquilizers. These help reduce anxiety, which can be beneficial for heart failure patients. Each treatment plan is tailored to the individual's specific condition and needs, aiming to manage symptoms effectively and improve the quality of life. Surgical procedures includes: in more severe cases of heart failure, surgery might be necessary to improve heart function. The type of surgery required depends on the underlying problem. Here are some common surgical procedures. Coronary artery bypass grafting, CABG. This surgery involves taking a healthy blood vessel from another part of the body and using it to bypass a blocked artery in the heart. This helps improve blood flow to the heart muscle. Heart valve repair or replacement. If the heart valves are damaged or faulty, they may need to be repaired or replaced with artificial valves to ensure proper blood flow through the heart. Biventricular pacing therapy, also known as cardiac resynchronization therapy. This procedure involves implanting a special type of pacemaker that helps both sides of the heartbeat in a coordinated manner. This can improve the efficiency of the heart's pumping action. Implantable cardioverter defibrillator, ICD. An ICD is a device implanted in the chest that monitors heart rhythms. If it detects a dangerously fast rhythm, it delivers an electric shock to restore a normal heartbeat, potentially saving the patient's life. Ventricular assist devices, VAD. These mechanical pumps are used to support heart function and blood flow in people with weakened hearts. VADs can be used as a temporary measure while waiting for a heart transplant, or as a long-term treatment option for those not eligible for a transplant. Heart transplant. In cases where other treatments are ineffective, a heart transplant might be considered. This involves replacing the diseased heart with a healthy donor heart. The success rates for heart transplants are about 88% after 1 year and 75% after 5 years, making it a viable option for many patients. Other treatments include sleep apnea management. Heart failure is often linked to sleep apnea. a condition where the muscles controlling airflow collapse during sleep, causing breathing interruptions. If you have heart failure, you may be evaluated for sleep apnea. Treating sleep apnea can significantly improve heart health and overall quality of life. These surgical and additional treatments aim to manage heart failure more effectively, enhance the patient's quality of life, and extend longevity. In conclusion, navigating congestive heart failure, CHF, and heart disease requires a comprehensive approach to managing symptoms, improving quality of life, and preventing complications. With over 5 million people affected in the United States alone, CHF remains a prevalent and serious condition, particularly among older adults. Ultimately, with ongoing research and advancements in cardiac care, there is hope for continued improvements in the management and treatment of congestive heart failure, offering patients and their families greater peace of mind and better outcomes. Please click on the next video for more Live Good info. Thank you very much.